All right, this is my interview presentation. So, the importance of interpersonal and communication skills. Communication is everywhere in nursing. So, you're communicating first and foremost with your patients, with your providers, respiratory therapists, pharmacy, lab, the family, everyone. So, communication skills are very important, and all the lessons that we are taught throughout the semester are really important to my future career in nursing. You'll be interacting with so many different people. You must know how to communicate. So that goes to it back to it being everywhere. You have to know how to communicate. You have to know the barriers. So like specifically what we talked about in our interview was a big barrier is language a lot of the time. So there's a lot of usually a lot of Spanish speaking patients, but you can get languages from literally anywhere. Also in Indianapolis, what I've noticed is there's a lot of Haitian Creole speaking patients. Um, so you are provided to get them to get a translator to be able to talk to these patients. So that was a lesson from this year in the content that I've learned that to be able to find those barriers and relate it to my profession is language is a big one of those barriers. Um, Another barrier would be sometimes when you're advocating for your patients people just aren't listening to you. So you just need to keep pushing, keep pushing, keep pushing and advocating and telling them, hey, you need to come to bedside and you need to look at these patients rather than them just telling you, hey, like, I don't think that we need this new med or I don't think they need a different pain med or something like that. Always remember your patients and families are vulnerable. So that goes to what we learned in class. Like the active listening. Your patients are vulnerable. You have to make sure you're actively listening to them because they could be telling you something really important. Um, they are vulnerable, so they can get really defensive really easily. So it's important not to take it personal as well, which is another thing we talked about within our interview. Jenny explained, we take a lot of abuse as nurses, verbal and sometimes physical. So it is really important to, approach in a calm and collected manner. And if someone is rising in emotions, it's important to, like we've learned from this semester, not to get our hot buttons pressed and to calm ourselves down, realize that we might be getting flustered or irritated or overstimulated, and to reel ourselves back and just maybe step out of the room, take a few breaths, realize the situation. And it's just important to remember their situation as well. And they are in the most vulnerable and emotional parts of these lives. And if you've ever had someone in the bed before or your family member in the bed, you understand where I'm coming from in that aspect. Application to my professional career. Remember to always be actively listening. That is super important within nursing. Like I said before, what basically you only know what they're going to tell you. You can look at their vitals, you can look at their labs, but um, all of that is subjective. Objective, you need to listen to what they're telling you and look at them and seriously listen to them and be in there. If you're having a conversation with them, and they're in the bed, sit in a chair, pull up next to them, be on their level. Because a lot of the times, if you're standing over them, they will just feel really pressured, and you don't want them to feel pressured. So you just want to sit down, have that nice posture, have that calm, cool, and collected voice, have your facial expressions, all things that we've learned from this semester on how to actively listen and show to the person that we are talking to or that is speaking to us that we are listening to them and we do care about what they're saying. So that is really important what we've learned from this semester, how to apply that to my professional career. Like I said before, recognizing your hot buttons, very important in nursing and honestly, like anywhere in your life. Like people are going to try to get to you, they're going to try to tear and get under your skin, and you just can't let that happen. You have to realize what your triggers are, and you have to reel yourself back in because you can't let people, especially in nursing, just take jab after jab after jab after you because it will break you down and you will get burnt out a lot faster if you are just letting people step all over you. Remember that you have the knowledge, you know what you're talking about, and um, again, these patients are vulnerable, so sometimes they will snap at you. It's not personal. Normally, it's not you, it's their situation that's irritating them. You just have to realize that. Don't let the doctors or anybody or your coworkers or anybody irritate you and try to push you down, especially as a new grad coming up, because sometimes you want to learn and other people are not as good at teaching, but or wanting to teach, but you just can't let that get to you. Take a step back, breathe and relax. I know for me that's like really important. Always try to think about what I say before I say it. I think I'm pretty good at that, but sometimes, I mean, sometimes we don't always think before we speak. So it's really important to do that in nursing. Remember your empathy and your why. That's a big part of me. We did the Clifton Strengths, and empathy was one of my top strengths. So just remembering like where I am grounded and who I am as a person, and remembering my empathy and why I'm doing this. Because I truly do care for these people. And even though they might snap at me accidentally or they might be irritated or something, just remembering this is why I'm doing this. I'm trying to make them not feel like this. I'm trying to make them not be stressed as possible and give them all the information that I can for them to be comfortable. So, just remembering your empathy and your why, and from this semester, learning empathy instead of sympathy. Because again, these patients, they don't want to hear, "Oh, I'm sorry." Like to them, they're probably thinking, "Oh, she says that every day. She doesn't actually mean it. She doesn't actually care." But if you truly have empathy and you sit with them and you pull that chair up and you sit with them and actually have a grounded conversation with them, and you're like, I understand this is your situation. What can I do to help you through this? What can I do to assist your family through this? That is empathy, and that's showing them that you truly do care, rather than just like, oh, I'm sorry. Like, yeah, that's what it is. So just doing that empathy instead of sympathy from what I've learned from this semester. And also, Jenny talked a lot about that too. She said she's overfilled with empathy all the time because she truly does care about these people. So, um, just making sure that we remember to always be empathetic because it is a big part of our job. My critique for the interview process, I have pros and cons. Pros, it really gave me a better look into the nursing profession. And especially since Jenny's from a local hospital, I think it really gave me some perspective on the local hospital. And made a connection with the nursing profession. Me and Jenny had a really great conversation. I really appreciated it with her. She told me I could use her as a reference, so that was really nice of her, and I enjoyed that conversation a lot. I learned a lot about myself and how I can better succeed in my future profession. I think this project was really good for applying what we have learned this semester to our professional careers, because that's the whole point of this class, leadership and collaborative leadership. Like in nursing, that's literally what your job is collaborative leadership. So especially if I want to be a charge nurse one day or go on to get my NP, whatever I want to do, learning to be that leader, and you have to learn how to communicate and have that communicational skills. So I thought that was really good for this interview process. Cons, just like not a lot of time to find a person to interview. I feel like it came up very quick. So, and then I was like scrambling to find a person to interview because since I'm from Lafayette, like I know like a lot of people. So Jenny's a travel nurse, so and she comes through the line at Seven Brew that I work at every day. So the next day I saw her, I just kind of ran up to her. I was like, "Oh my gosh, hi, like how are you today?" I gave her a drink and I was like, "I know you're a nurse because like at Seven Brew you're supposed to talk to your customers, and I've talked to her before, so I knew that she was a nurse." And I was like, "Would you care if I interviewed you for this project?" And so that was like she was like, I don't know, it just felt like really rushed. So maybe like a couple more reminders would have been helpful. And then since that was so rushed, like at the beginning and the actual presentation and paper wasn't due till the end, I feel like there was a lot of time in between the interview sheet and the actual interview paper. So maybe instructing like future students to do the interview as soon as possible after the interview sheet and after you ask them as possible to get it out the way. Because I feel like if you like wait and wait and wait and wait, wait, maybe a person won't be available anymore, or they'll forget that they said yes and they can't anymore. And if you don't like in the instructions, if you don't do the same person on the interview sheet, then you'll get a zero or you lose points. So maybe like doing your interview like right after with your interview sheet would be helpful. Um, so that's not recommending future students do their interviews soon after asking the person, just for time's sake. But yeah, those are my pros and cons, and I thought this was a really good project, and it brought a lot of insight and really helped me really connect the dots between this semester and understand, like, honestly, how good this class is for, I think all Purdue students should take this class because all of us are hopefully going into a distinguished profession that where everybody's going to need communication skills no matter where you work. You'll be sending emails to someone one way or another. So it's good. This class was really good for all professions, in my opinion, and I loved it to connecting it to the nursing profession in my future. Thank you.